Hello everyone, welcome back to the channel. This is Amin Ibrahimi, physical therapist, and today we're exploring an essential topic in sports medicine and orthopedic rehab, ACL rehabilitation and physical therapy. Whether you're a patient recovering from ACL surgery, a physical therapy student, or just someone interested in human performance and healing, this video will walk you through everything you need to know, from injury to full recovery. Let's start with the basics. The ACL, or anterior cruciate ligament, is one of the four major ligaments in the knee. It runs diagonally in the middle of the knee and prevents the tibia from sliding out in front of the femur. It also provides rotational stability. Tearing the ACL is one of the most common knee injuries, especially in sports that involve cutting, pivoting, and sudden stops. Think soccer, basketball, skiing, football, and gymnastics. When the ACL tears, people often report a popping sound, immediate swelling, pain, and instability when walking. Diagnosis is typically confirmed through a physical exam and MRI. Now, here's something interesting. Contrary to older beliefs, we now know that some ACL tears, particularly partial tears or proximal tears, may heal on their own under the right conditions. Imaging research has shown that with bracing and a structured rehab, certain cases don't always require surgery. However, healing depends on the location and severity of the tear, the patient's activity level, and commitment to rehab. For high-demand athletes or those with complete tears and instability, surgical reconstruction is still often recommended. The main goals of ACL rehab are simple but crucial. 1. Restore knee joint function and mobility. 2. Build strength and coordination. 3. Protect the graft as it heals. 4. Return the patient to the pre-injury activity level safely. But this isn't a one-size-fits-all plan. Rehabilitation must be individualized, based on the person's age, activity level, and whether other structures were injured, like the meniscus or MCL. Rehab is typically broken into phases. Let's go through each one in detail. If time allows, prehabilitation, rehab before surgery, can improve outcomes. The goal here is to reduce swelling, restore range of motion, and maintain muscle strength. Exercises might include heel slides, straight leg raises, quad sets, and stationary biking. This phase ensures the knee is in the best shape possible before surgery, which often leads to faster post-op recovery. Phase 2, early post-operative phase. Now, post-surgery, the focus shifts. We want to control pain and swelling, begin early range of motion, start gentle quad activation, and protect the graft. Cryotherapy, compression, and elevation are vital. Patients often use crutches and wear a brace during this stage. Physical therapy includes ankle pumps, heel slides, quad sets, assisted knee bending, and patellar mobilization. The goal here is to regain full knee extension and at least 90 degrees of flexion within 2 weeks. Phase 3, intermediate phase, weeks 2 to 6. Now we build on that foundation. Key goals include achieving full range of motion, improving muscle control, beginning weight-bearing activities. Progressive exercises include leg presses, step-ups, closed kinetic chain exercises, and balance drills. By week 6, most patients are walking normally without crutches. Core and hip strengthening become a bigger focus. Phase 4, strengthening and neuromuscular control, weeks 6 to 12. This phase gets more intense. The graft is still healing, so we're careful, but we ramp up strengthening. Goals include developing quad and hamstring strength, enhancing balance and proprioception, and light impact training. Sample exercises include lateral band walks, mini squats, single leg bridges, and balance board work. Phase 5, advanced strengthening and running, 3 to 5 months. This is where athletes really start to feel like themselves again. We introduce plyometrics, light jogging, lateral movements, and sport-specific agility training. We are constantly assessing biomechanics here to correct any asymmetrics. Improper form can set people up for re-injury. Phase 6, return to sport, 5 to 9 months or more. The final phase is highly individualized. We use return to sport testing, which may include isokinetic strength testing, hop tests, agility drills, and movement quality analysis. Many experts now recommend a minimum of 9 months before returning to pivot-heavy sports, depending on progress. Delaying return by even 1 month reduces re-injury risk significantly. And now, here are some common pitfalls in ACL rehab. Pushing too fast, especially with running or cutting drills before the graft has integrated. Neglecting the hip and core, which are vital for knee stability. Not restoring full extension early, which can permanently alter gait. Poor neuromuscular control, leading to compensatory movement patterns. Rehab should always be supervised by a trained professional. Home exercises are essential, but guidance is key. Let's not forget the psychological toll of an ACL injury. Fear of re-injury, frustration, and loss of identity are common, especially in competitive athletes. In fact, studies show that confidence, mental readiness, and motivation are just as important as physical strength when returning to sport. Working with a sports psychologist or using visualization and goal setting techniques can make a big difference. Prevention is always better than cure. ACL injury prevention programs are highly effective, especially for female athletes who are at higher risk. Programs should include proper landing mechanics, hamstring strengthening, core and hip control, agility drills, and neuromuscular training. FIFA 11 Plus, PEP program, and other structured warm-up protocols have significantly reduced ACL injury rates in sports teams. ACL rehab is a marathon, not a sprint. It's complex, individualized, and requires patience, consistency, and expert guidance. With the right plan and mindset, though, full recovery is possible, and many athletes return even stronger than before. If you found this video helpful, hit that like button, subscribe for more content like this, and drop your questions in the comments. I'd love to hear about your experience or concerns with ACL rehab. Thanks for watching, and stay strong out there.